with everyone. Nice to meet everyone. Hopefully, we'll have some time for kind of questions. I'll just share a little bit about myself and how I ended up in this kind of role as well, because I think a lot of students who are interested in this, they don't see what the path forward is. Like, what does it look like to get involved and meaningfully participate in this work in your career? And my what I am doing is by no means the only way you can meaningfully participate in this work. I think there are a lot of different ways you can do it, but it is one way. So I'll share that way. So I actually, what I originally got me involved and interested in this work was volunteer experience with NGO called Health and Harmony that did this kind of really interesting work. In kind of partnering with communities outside of national parks in rural Borneo, kind of working with those communities to help them get alternative livelihood training so that they wouldn't be participating in these extractive logging practices in these beautiful national parks in Borneo. And one of the things that those communities said that they needed in order to make that feasible for them was they needed healthcare. So kind of pairing this idea of environmentalism with healthcare, that was what originally instilled that in me. And it's been a really successful model, that NGO, and they've expanded to Madagascar and Brazil, and it's cool to see how they've grown. But I then completed medical school and residency, and like, totally frankly, you're like already like way ahead of me. I had no like medical school like training in climate and health. Like, there was nothing available at my medical school. And I did, frankly, my policy in residency was like, this is enough. Like, learning emergency medicine is plenty for me, and I think that is that's how I instruct my residents too, is like, if you can do something more, great. But if you can't, that's like, I don't expect anything more of you. Um, but then I was thinking about my career and how I wanted to kind of, integrate these kind of values of environmentalism into my career. And so I kind of started exploring that, and kind of serendipitously around that time, the first physician fellowships in climate change and health started cropping up. The first one at the University of Colorado, where I attended, and there more recently has been one that's cropped up at Harvard. So it's fun to see how there are dedicated opportunities for people to explore this, whether you're interested in advocacy and education or research. There's a lot of opportunities out there for you, and even if you don't want to do a fellowship, there are opportunities as well to get involved and learn and become a leader in this space. So with that, I'll kind of jump in. So I'm going to kind of walk you through a number of different areas of my work, kind of starting kind of more local, and then looking more at the national stage, and then ending with a project that is near and dear to my heart that I'm sure Brian has heard enough about at this point. But yeah, so this is our brief agenda as I outlined. And this is I kind of frame this as kind of the credo that I live by in terms of why I care about this work, and I think why it matters in healthcare. That this is from the Intergovernmental Panel on Climate Change. This is from their 2022 report. But what they said is that with the severity of climate-related health risks is highly dependent on how well health systems can protect people, and with timely, proactive, and effective adaptation, many risks for human health and well-being could be reduced, and some potentially avoided altogether. So, I don't know, where all of you stand on the like optimism versus pessimism kind of scale in terms of how well we are going to do in terms of mitigating our global emissions. I certainly kind of oscillate from day to day in terms of how pessimistic I am. But I think increasingly what we recognize is that regardless of how well we mitigate these hazards, we know that there is a certain amount of change and warming and impact that is already built in from climate change and baked into what we're going to see. and we can't avoid it at this point. And so we have to start thinking about how we adapt to those risks and those hazards. And I think one of the most effective interventions for adapting is, and what I care about and what I spend most of my time doing, is educating healthcare professionals about this so that they're aware and knowledgeable and can educate their patients and make sure their patients are safe as well. So first, jumping in at the local level, the title slide for this lecture mentioned that I am the Planetary Health Theme Director for the University of Washington School of Medicine. That means that I design and implement a curriculum spanning our 4 years in climate change and health. And it's specifically titled Planetary Health Curriculum because there are, of course, other planetary health hazards other than climate change. We think about biodiversity loss. We think about habitat degradation. We think about the plastics crisis. There are a lot of other things going on that interfere with health and that, I think physicians need to be familiar with to some degree. So I'm just going to briefly talk about a little bit about the evolution of our curriculum here at the University of Washington. I'll say that, I think this is useful for you to know because this is very much still a growing thing across our country. If this is something that you care about and want to become a leader in, medical schools all over the country are looking for people who are knowledgeable and willing to jump in and, build out their own curriculum in this, because I'll say that, I think probably within the next few years, there will be kind of LC&E standards and recommendations around medical schools having education in this, similar to how they have ethics curriculums and health system science curriculums and, the like. So it is definitely something that you can get involved in and participate in and support. So just briefly about the University of Washington and our kind of position, we're one of the first medical schools to commit to kind of achieving this kind of 4-year integrated planetary health curriculum across our 4-year curriculum. We have kind of a unique challenge and opportunity in that we work with medical students and educators across our WWAMI region, which is the 5-state region, which is almost a third of the total landmass of the United States, which includes Alaska, Idaho, Washington, Wyoming, and Montana. And that's exciting, and there's a lot of interesting opportunities in conducting that kind of educational work. But there are obviously challenges as well, right? The planetary health hazards and the climate-driven hazards of someone living in rural Wyoming or Montana might be and are significantly different from the hazards that are relevant and top of mind for patients and educators in rural coastal Alaska, right? So we have to be mindful of that and think about how we tailor our education to address all those hazards. In terms of the timeline of how this curriculum came about, I'll say that it started with students, and as it so often does, some here are probably familiar, the Planetary Health Report Card is a student-led international initiative which helps students kind of grade their curriculum on how well it's doing in terms of educating them on climate change and planetary health hazards. And our students at the University of Washington performed one of these report cards and identified that we were lacking and that there was a great deal of room for improvement. And that work by the students sparked our dean and our curriculum committees to say, okay, wow, and the power of that kind of program is that it's they're able to say, hey, you're doing this much worse than your peer institution at OHSU down the road, or, you want to compete with the Harvards and Yales of the world. This is how much better they're doing in this than you. And that really gets their attention. And so that did get their attention. They created a work group, which I was a part of, which I was serendipitously, when I joined the faculty here, was just getting started. And that was a work of a couple of years, and we kind of reviewed our curriculum and provided recommendations to the curriculum committee on how that could be improved. And finally, that kind of culminated in me being named as the planetary health theme director to kind of steward this work forward into the future. Um, so we've made a number of kind of enhancements to our curriculum. Uh, I think there are a number of kind of key things that we try and work on. One of them being kind of environmental history integration, how to take a good environmental history, how do you make sure students are familiar with that, and how to do that in a clinical encounter. Of course, we introduce kind of the impacts of climate change and climate hazards on various different organ systems during the preclinical years of the first and second years of medical school. So how it's impacting the cardiovascular system, how it's impacting the respiratory and renal system, how it's impacting the reproductive and development system. So we kind of partner with block directors to implement that. We also have interdisciplinary lectures where our students work with their nursing colleagues or their social work colleagues or their pharmacy colleagues to think about how they address these problems in real-time clinical scenarios, such recognizing that, we all, in medical spaces are operating in teams, and it's not on just one member of the team to address this. We all have to be thinking about this and what our part is in addressing it. And then we have a number of community partners and thinking about how we support our students in doing that work. So broadly speaking, we have kind of four goals, and our philosophy when it comes to this curriculum is that we want all students to walk away with kind of a foundational understanding of this content, but then we also want to offer opportunities that are tailored to that maybe 5% of students who are highly motivated and engaged around this topic too. So we want to provide that foundational knowledge, those clinical skills, but then also offer opportunities for research and advocacy training and thinking about how you can use your voice as a leader, because all of you will be leaders as physicians in your communities, to use that voice and advocate for this if it's something that you care about. When it comes to kind of our strategic process, this might be getting a little bit in the weeds, but the reality of integrating content into curriculums, you might already be very familiar with this as medical students, but man, the medical curriculum is packed. There's just a lot of content, and going to a dean of a school of medicine and saying, "Hey, I need 3 weeks to teach about climate change," it's just like it's a non-starter. Like they're just going to laugh at you. So thinking about how you can do this strategically is important. And so what our approach is, we engage leadership, which I've talked about. We want to support our educators, and so we partner with the block directors. We approach them and say, "Hey, this is the content we want to create. We have this mandate from our curriculum committee to integrate it. This is how we can work with you. We can teach a lecture if you have time for it. If you don't, we can work with your lecturers to put in a couple of slides here or a problem-based learning case there around that, that addresses some of these climate-driven hazards and how it impacts health." And I'll mention, I think, these here later as well, but the Climate Resources for Health Education and Medicine for a Changing Planet are two fantastic open access resources that help to kind of integrate that content in a modular way, which has been really helpful. And I think a lot of different institutions have started to employ them. The preclinical curriculum, again, it's approaching it from this kind of organ system approach. Let's address it from the cardiovascular block, the respiratory block, the renal block. Great. The other part of our curriculum is, as I mentioned, we want to offer, more elective opportunities for students. One of those is our Rural Underserved Opportunities Program, where after their first year in medical school, students have the opportunity to be paired with a clinician in the community, either serving a rural or underserved population, usually a rural population, And as part of that clinical kind of appointment, they also have a responsibility to conduct some kind of community oriented research and or project. And one of the ways we are building this out is offering a pathway for students to be able to conduct that research or project um, uh, around a planetary health hazard in their community. So that's one thing that we're doing. We've had a lot of success. Fortunately, we've had a lot of buy-in from our curriculum committee and our deans in terms of implementing this curriculum, which has been great. And so we've seen a lot of progress over the last couple of years, and that's led from to our curriculum in the planetary health report card going from a D in 2021 to a B in 2024, which is great. So we've seen some real progress in terms of how our students are perceiving their curriculum in terms of its ability to deliver this content to them. Kind of some of the next steps that we're thinking about is some recent work that I was involved in with the AAMC was thinking about what are the actual competencies that we want medical students to graduate with when it comes to some of these problems around climate change and health. And so we developed kind of a competency framework that the AAMC is not fully adopting yet, but kind of because they're a very political organization, they're kind of endorsing. And this is some of that work, and it helps to both think about how you build out a curriculum, what are the essential pieces of a curriculum in this, but also how do you assess students, because without those competencies and what we expect, it's really difficult to assess students in what they've actually learned. And then finally, the next thing that I'm working on is here in our curriculum is building out the clerkship phase curriculum, which as I think probably most students here are third or fourth years. During clerkships, there are a lot of barriers to kind of this kind of education. One being that there's not a lot of didactic time during clerkships, but also you're kind of like, depending on the medical school, especially this is the case at the University of Washington, you're kind of, your medical students are just kind of spread out to the wind, right? Like we have medical students who, get shipped off to all over our WWAMI region, and expecting all educators across that whole region to be able to educate their students around this is a huge lift. And continuing medical education in this is important, but we need to be able to get this content out to our students fast. And so we've developed an asynchronous and self-paced curriculum where students can complete modules around this in various different clerkships that teach them about both the resilience factors, but also the sustainability factors in, how do you be more sustainable in emergency medicine on your emergency medicine rotation? How do you be more sustainable, and how do you teach your patients about how to be more resilient if you're on your pediatrics rotation? So that's what we're building out now. And then just a little bit more about some of our local work. Actually, here this week, we have our yearly climate change and clinical practice symposium, which was originally just a very local, small University of Washington medicine and School of Medicine meeting, but is grown to become more of a regional WWAMI and Puget Sound Health System symposium, where we gather stakeholders, mostly focused around this kind of clinical practice nexus as opposed to the public health practice, and learning for kind of a day of learning around how climate change is impacting health and what's going on, and what kind of research and new work is coming out. So we are hosting our next one on Thursday. So wish us luck. The other thing that another thing I've been involved here locally is that the Washington State Healthcare Authority leads this ongoing process improvement kind of collaborative called the Bree Collaborative, and one of their recent initiatives was specifically the health impacts of extreme heat and wildfire smoke. And so I worked with that group to support the development of a kind of a comprehensive set of recommendations that go out to all healthcare providers, whether you're a nurse or a physician or a pharmacist, to think about how we can all be approaching this issue, and how we need to be updating our staff to be familiar with these issues. And then shifting a little bit to the national and international stage, when I started, this work, several years ago, it was clear that one of the major barriers was the content itself. People had written a lot of papers, people had recorded lectures, but none of that really translates to what that actually looks like in a classroom teaching medical students. And so, let alone the highly specialized classroom teaching that is needed to teach other healthcare professionals. So that was kind of the impetus for the creation of these two resources, which I was involved with partially during my fellowship, was the development of the Climate Resources for Health Education, which is another student-led initiative. And if you as a student or as a resident, because they're building that out as well, are interested in getting involved in developing this content, there are opportunities for you to do so. You can look at their website. But these are resources that provide modular content that can be plugged in. It's kind of a plug and play model for this content of, here is a slide deck on wildfire smoke and cardiovascular disease, or this is a slide deck on how wildfire smoke impacts preterm birth. So it provides specific health-oriented lecture material and problem-based learning cases that can be integrated into lectures for medical students and other health professionals. Turning a little bit to some of my more research-oriented work, after working in this kind of climate and health education space for a while, I think myself and my colleagues started noticing that there's really we're starting to see a shift. Increasingly large national societies and accrediting groups are starting to recognize the importance of this work. The American Medical Association, the AMC have come out with formal recommendations that this is important. Our practitioners need to be familiar with this, and medical students were taking notice, or medical schools were starting to take notice. And from 2019 to 2024, the number of medical schools reporting here in the United States that they were teaching climate change and health and in some form jumped from 15% to over 65%. So that's a pretty dramatic increase in just a few years. But I think, that begged the question for many of us who are, intimately involved with this work is, what was the form that teaching was coming in? Were they teaching one class? Was there an elective? Was it mandatory, or was it an optional opportunity for students? Was it longitudinal and integrated across the curriculum? And this question launched this project that I'm working on with a number of other colleagues here and elsewhere in the world, which is some of you are probably familiar with the Lancet Countdown on climate and health. But they have a number of kind of indicators that are designed to help us track progress on this work over time. And so in partnership with them, we created a survey that is designed to survey medical schools all over the world on what they're doing, but not just what they're doing, get into that nitty gritty of is this a mandatory or is this optional? Do you have an elective? Is this longitudinal? What is the state of play of your climate and health education at your institution? And so, this is the survey we created in our first year, and we're starting into our second year now. We had 170 medical schools globally who participated in that survey, and we're on track to have even more for our next year. As I mentioned, the climate curriculum competency framework was a kind of important step in terms of when you go to a medical school and say you need to be teaching this, they need to know, like, all right, what are the competencies that we actually need to learn or our students need to learn. And so this work that we engage in partnership with the AAMC was really critical to moving and stepping that forward. And then finally, I'll say that one of the greatest barriers is to all of this work is that you as medical students, you're really, really good at figuring out what's going to be on the test and what's not going to be on the test, and specifically your board exams. And so, we're on to you. We've figured you out, and we've myself and a couple of my colleagues work with the NBME, and we are writing questions that specifically look at climate hazards and the health outcomes and what we can be doing about them and the recommendations we can be providing our patients around them. And as I kind of mentioned, the reality is that many medical schools around the country have not gotten up to speed with this and are not teaching their students on this. So much of this is very foundational, basic content, but it provides a foundation for us to build that out as that content gets more and more prevalent across the US. So next, I'm going to talk a little bit about Climate RX, which is a campaign which I helped to develop, which is designed to empower healthcare professionals to engage in communication with their patients around this issue of how climate change is impacting health. And I'll say that this is something I created during my fellowship, and I share it with you now, mostly as an illustration of the fact that the reality is that there's just a lot of work that still needs to be done in this space in climate and health. And so you as medical students participating in this, climate elective, if this is something that you care about, this is something, you want to find a way to integrate into your career, there are opportunities out there for you. And there are ways that you can, innovate and become leaders in this space. And I think this is a good example of that, in that, this was something that I created in my fellowship. All I did was I recognized, first of all, I participated in a campaign during my residency, which is called the BODR campaign. And that was a revolutionary campaign that basically, had these badges and, promoted conversations around voting as a healthcare issue in healthcare spaces, and allowed medical practitioners to support their patients in registering to vote. The person who started that campaign, Dr. Martin, is now the health commissioner for New York City. His work has been so innovative. And what I saw is that there was a similar opportunity in that, participating in the BODR campaign, I saw this amazing kind of new dialogue around voting as a healthcare issue crop up in medical spaces in a way that I hadn't seen it happen before. And I saw climate change as a similar problem, something that, is a healthcare issue, but is not often talked about in clinical spaces, both between, physician to physician or healthcare provider to healthcare provider, but also between healthcare providers and their patients, even though we know it should be. And there are a number of specific barriers that have been identified that kind of help to explain why that may be. The first, of course, as I've been talking about pretty much since we started, is that the majority of healthcare professionals have not had formal education around the impacts of climate change on health. And so they do not feel knowledgeable enough and don't feel like they can be an authority with their patients to teach them about this content. The second most commonly cited barrier is time. Healthcare professionals are already super stretched for time. It's really hard to ask them to do more and to say, you need to go and have a conversation with your patient about climate change. Again, it's a non-starter for most healthcare professionals. You need to find a way to make that more accessible to them, something that is accessible in their clinical environment. And then finally, the other most commonly cited barrier, and this is kind of twofold, is one, um, they healthcare providers worry that they will be judged by their colleagues for talking about this and integrating this into clinical spaces. And part of this is because this is for unfortunately a very political issue in our country. That climate change in general is a politicized, polarizing issue, and they worry that their colleagues are going to think less of them for engaging in this. Fortunately, we have a great deal of evidence that has shown that healthcare professionals, the vast majority of healthcare professionals, identify this climate change as a healthcare issue, know that climate change is a healthcare issue that is already impacting the health of their patients, and feel a responsibility to, support their patients in being healthy and staying healthy in their community in the face of these hazards. So that's a perceived barrier more than it is a real barrier. So we created this campaign, and so it's a very simple intervention. You wear this badge; it's attached to your ID badge. It has, depending on whether you have a horizontal or vertical lying badge, it has a prompt that sticks out saying, "Care for your health in a changing climate, ask me how." So it is designed to prompt those conversations. So it creates that opportunity for that conversation to happen, but also recognizing that, again, most healthcare professionals do not have the knowledge. We don't expect you to be an expert. All you have to do is, if your patient is interested, they can scan the QR code and they get access to a lot of evidence-based resources, teaching them about how climate change is impacting health, but also more specifically providing them with specific solutions for them to stay healthy at home and in their community. And then again, this also addresses that the barrier of time, because again, we're not expecting you to sit down and have a whole conversation. All we expect you to do, and if you want to do more, great, but all we expect is you wear the badge, and when a patient or a colleague is interested, you allow them to scan the QR code and learn a little bit more on their own. And that takes almost no time out of your busy clinical schedule. And then addressing that final kind of barrier of the perceived lack of support from peers. I'll say from personal experience, having a bunch of colleagues walking around wearing this badge, it starts to break down that perceived lack of support pretty quickly when you see that your colleagues are out there and care about this issue and are wearing something that demonstrates that. So again, our goal is to empower healthcare providers and their status as trusted messengers. We want to establish a community of practice amongst healthcare providers to engage on issues at the intersection of climate change and health. And there is a community if you sign up for Climate RX, and I should say that if you want a badge, you can go online and you can get one badge, or you can get a batch order of badges to distribute to yourself and your colleagues if you want. And we also want to kind of establish some best practices for how healthcare providers can engage with their patients effectively on climate change and health issues in clinical spaces. Now, this program, since its start, and I started during my fellowship in 2022, there are now 16,000 healthcare professionals all over the country who are actively using these badges. And it's been endorsed and recommended by a whole slew of different kind of healthcare professional institutions, some of them listed here. It's been cited as a tool for healthcare professionals in a bunch of different journal articles. And so it's really blown up since I started. And it just started with this very simple idea for me of hey, we're not talking about this enough in clinical spaces. We're talking about it in research and some people are starting to talk about it in educational spaces. But what we really need is we need to bring this to the bedside. We need to start talking to our patients about this. And so that was kind of the whole idea. And again, I think that's a good illustration of how a very simple idea can expand and grow quite a lot, and how there's a lot of opportunity for growth in this still fairly nascent space of climate change and health. Some preliminary results. I worked with some medical students at George Washington University in DC, and they wanted to study this intervention a little bit and specifically look at those kind of metrics and how well we were breaking down barriers. And so we saw that the majority of people and healthcare practitioners who were engaging and using the badge felt more confident in engaging with their patients and colleagues around this issue when they were wearing the badge. It increased their overall engagement with patients, and it increased overall engagement with colleagues. And the majority of them felt supported by their colleagues in the use of this badge. And I think probably what was most exciting for me in this study was that they found that this wearing the badge was a good starting point for people to start thinking about and exploring this problem more. So for people who had not previously delved into this issue, much in their, professional career so far, wearing the badge was kind of a gateway drug, if you will, to exploring the issue of climate change even more, which was great because we definitely need more of that. And then again, the majority of them were recommended the Climate X badge to their colleagues as well. I'm not going to play this video because I don't think that it's basically kind of like a testament of a number of different healthcare practitioners who submitted videos of how they use the badge in their own clinical environment, but I won't present that here. This is a picture of those medical students because I'm very proud of them. They did such a great job. They presented at the Medical Society Consortium meeting last year on some of this work. Yeah, just as a reminder, climate action is health action. So with that, I will stop my share and we can see if there are any questions or if anyone wants to bring anything else up.
There's one in the chat, Stefan, from Tanner. I don't know if you can see that with the QR code effectiveness with patient engagement.
Okay, yeah. Thanks, Tanner. Yeah, so Eco America is the